Our thoughts and prayers to the families that have lost their loved ones, and to those that were injured, we wish them quick recovery. On to yet another looming crisis in the health sector. The Kenya Association of Private Hospitals is now threatening to rally its members to withhold services to beneficiaries of the defunct National Hospital Insurance Fund (NHIF). They say this is due to what they term as a breach of contractual terms, which has left the hospitals owed more than 20 billion shillings by health insurer. Our health and science reporter Gloria Milimu has more on that story.
Kenya is yet again staring at another public health crisis should the defunct National Hospital Insurance Fund fail to resolve the current standoff between it and private hospitals over reimbursement issues. The private hospitals, through the association, have issued a 7-day notice of withdrawal of services should NHIF fail to pay monies it owes them. Through a letter seen by KTN News dated 12th March and addressed to NHIF CEO, the Kenya Association of Private Hospitals decried delayed payments of its member hospitals, saying the move has crippled the hospital's operations. For this reason, the association says its members will not offer services without payment. They're now demanding that NHIF releases all funds owed to its members. According to the letter, the payments are in line with contractual agreements that require clearance and payment of claims after 60 days of offering service. They say failure will lead to withdrawal of services to all NHIF beneficiaries. The Kenya Healthcare Federation has also weighed in on the matter. It states that the impasse threatens the successful delivery of universal health coverage. The Federation says many healthcare providers, particularly those outside major urban centers, rely heavily on NHIF reimbursements. It further says at least 57.7% of the providers have not received capitation for managed schemes. This has resulted in more than 20 billion shillings being owed to the industry by the national health insurer. Kenya Healthcare Federation also claims that a further estimated 6 billion shillings is locked in the old e-claim system since 2017. It has also decried the current reimbursement rates of between 5 and 15% of monthly billings. The Federation says the amount is insufficient to cover fixed overheads like staff salaries and rent. A move they warn undermines the quality of care of providers as they struggle to afford essential supplies and equipment.
I'm Mitchell Fuller, the Cabinet Secretary for Health.
In her response to questions raised by the Parliamentary Health Committee on the criteria used to prioritize settlement of NHIF claims this week, Health Cabinet Secretary Susan Nakumicha said reimbursement of claims to hospitals was fully dependent on the availability of funds.
Currently, NHIF claims reimburses claims based on availability of funds received from statutory deductions from the formal sector, revenues from the informal sector, government remittances for sponsored programs and enhanced schemes and premiums. Reimbursement of claims to hospitals is therefore fully dependent on the availability of funds.
Further, she was put to task to explain why there are delays in payments of monies owed to NHIF to some hospitals.
29 billion is outstanding that we have not received from the exchequer. Some of that from the ministries that we have already provided service, like the National Police Service. We haven't been paid those premiums, yet services were already provided.
The government is said to owe all NHIF-accredited government and private health facilities at least 32 billion shillings. An additional 480 million shillings is owed to the Nairobi County Medical Facilities, and another 1.6 billion shillings is owed to Kenyatta National Hospital. Gloria Milimu, KTN News.
Still on the hailing